Hello, my name is JT, and today I'm going to be spotting the compensation from video number 3, which has 3 parts to it. In the first part, we see a girl trying to perform elbow flexion. We know that women have more of a normal carrying angle than men do, and we know that the normal is 6 to 19 degrees. Her elbow has a little bit more than that. It's a little bit excessive, over 19 degrees, so we're going to say that she has some cubitus valgus going on. In the second video, we see her doing a joint mobilization using her right arm, and we see that her right arm can't fully extend. It's kind of staying in that flex position. Then in the third video, we see her doing that same joint mobilization using her left arm, and we see that her left arm can fully extend. This tells us that she does have a problem going on in her right elbow because of this asymmetry. It's obviously not normal for her to have that much limited extension in that right arm. So we know that the humeral ulnar joint in itself is a hinge joint, which means it only has 1 degree of freedom, flexion and extension. It gets most of its stability from the bony structures itself, especially in that mid-range of flexion. But once she's in that extended position, you get a lot of your stability from the MCL on the inside of the elbow. Because of that valgus position that our elbow stays in, you're putting a lot of stress on the MCL, more than normal. And since that's the structure that resists valgus force, over time it can start to wear down. Maybe the reason that she can't fully straighten her arm out could be from a tight anterior capsule, maybe a shortened biceps, or just stiffness in that joint. And this could have developed from a couple of different things. Maybe an old injury that changed the alignment of the bones, repetitive stress on the inside of that elbow doing joint mobilizations all day, or it could just be from some soft tissue tightness or weakness in the triceps, not letting her fully extend. Because of that increased valgus angle, the MCL is getting stretched more than normal, and over time this could irritate the inside of the elbow, or even cause some discomfort where the ligament attaches. Overall, the big takeaway is that we see some cubitus valgus and some limited extension on her right arm. If I was working with her, I'd probably do some mobility work, maybe strengthen the triceps, or just clean up her movement pattern to try and keep the MCL from getting overworked.